In this video, you will know the symptoms of all types of diabetes. Diabetes is a chronic condition that affects how the body regulates blood sugar, glucose, levels. Symptoms of type 1 diabetes, insulin-dependent type 1 diabetes. Type 1 diabetes is an autoimmune condition in which the body's immune system attacks and destroys the cells in the pancreas that produce insulin. Here are some of the most common symptoms of type 1 diabetes. Cholelithypsia, increased thirst. This is one of the most common symptoms of type 1 diabetes, as the body tries to flush out excess glucose through urination, leading to dehydration. Frequent urination. People with type 1 diabetes may need to urinate more often than usual, especially at night. Cholelithypsia, extreme hunger. The lack of insulin in type 1 diabetes means that glucose can't be properly used by the body's cells for energy, leading to increased hunger. Fatigue. Without enough glucose being properly utilized, the body can feel tired and lethargic. Unintentional weight loss. As the body begins to break down fat and muscle for energy, weight loss can occur. Blurred vision. High blood sugar levels can affect the eyes, leading to blurry or distorted vision. Increased susceptibility to infections. High blood sugar levels can weaken the immune system, making people with type 1 diabetes more susceptible to infections. Symptoms of type 2 diabetes. Type 2 diabetes mellitus. Type 2 diabetes is a chronic condition in which the body becomes resistant to insulin or does not produce enough insulin to regulate blood sugar levels properly. Here are some of the most common symptoms of type 2 diabetes. Cholelithypsia, increased thirst. To filter and absorb the extra glucose, your kidneys must put in extra effort. You get dehydrated when your kidneys can no longer handle the extra glucose that is discharged into your urine along with fluids from your tissues. You'll likely become thirsty after this. Frequent urination. You get dehydrated when your kidneys can no longer handle the extra glucose that is discharged into your urine along with fluids from your tissues and will drink and urinate more. Cholelithypsia, increased hunger. That's because your body's insulin resistance prevents glucose from entering the muscle and supplying energy, so your muscles aren't getting the energy they require from the food. Hence, in an effort to increase the body's supply of energy, the muscles and other tissues send out a hunger signal. Fatigue. An indication of hyperglycemia is fatigue, high blood glucose. Blurred vision. The center of the retina, the macula, which gives clear, straight vision, may expand as a result of leaky blood vessels brought on by diabetes. Slow healing of wounds. Diabetes can also reduce the ability of the skin to heal itself. Even small cuts on the feet can develop into diabetic foot ulcers, chronic, non-healing wounds that are vulnerable to infection. Numbness or tingling in the hands and feet. High blood sugar levels can damage the nerves in the hands and feet, causing numbness or tingling. Yeast infections. People with diabetes frequently battle with yeast infections because high blood sugars make it easy for yeast to proliferate. Skin darkening. In some cases, people with type 2 diabetes may develop patches of darkened skin, especially in the folds of the skin, such as the neck or armpits. Symptoms of gestational, pregnancy, diabetes. Pregnancy diabetes, also known as gestational diabetes, is a type of diabetes that can develop during pregnancy. It is characterized by high blood sugar levels that can cause health complications for both the mother and baby. It's important to note that some women with pregnancy diabetes may not experience any symptoms, or their symptoms may be mild and go unnoticed. But some pregnant females shows common signs like excess urination and increased thirst. Here are some of the other common symptoms of pregnancy diabetes. Itching in genitals. Itching in genitals, i.e., mons pubis, labia majora, labia minora, clitoris, vestibular bulbs, vulva vestibule, Bartholin's glands, Skene's glands, urethra, and vaginal opening. Dry mouth. Dryness of mouth can also occur in gestational pregnancy. Can symptoms of diabetes occur suddenly? Yes, symptoms of diabetes can occur suddenly and without warning. In fact, some people with diabetes may not experience any symptoms until their blood sugar levels are very high. This is particularly true for type 2 diabetes, which can develop slowly over time and may go unnoticed until routine blood tests are performed. If you experience sudden or severe symptoms of diabetes, it's important to seek medical attention right away. If you want to know more about diabetes, then click a link below.